Okay, hi guys. I'm really glad to be here with you today, and I wanna represent you the lecture about heart, cardiovascular system. My name is Dr. Boris, so let's go. You know this, in our body, blood moving all the time. This blood pumping by biggest pump which have named their heart, right? And you have to remember that your heart working all the time. You're eating, you're walking, you're sleeping, you're sitting, where you want. It didn't matter what you do, but your heart all the time working. So that's why you have to protect this main organ against the disease, external environment, every like stress, nerves, everything. So the normal weight of the heart, it's near 200-300 grams, located behind the breastbone, sternum, in the middle of the chest, a little bit into the left. Into the both sides of the heart, we have the lungs, left and right lungs. Heart, behind heart, we have a vertebral column, and heart located inside the pericardium, the big sac back for the heart, right? And pericardium have two layers. Parietal layers, which consist from the fibrous and serous, and visceral pericardium. Parietal pericardium, visceral pericardium. Between this parietal and visceral pericardium, we have the space which contains the pericardium fluid, serous fluid. Okay, on the pericardium, we have the epicardium. After this, myocardium, it's muscle, and heart have four chambers, two atrium, two ventricles. So the wall of the atrium consists from the two layers of the muscle, and ventricles have three layers of the muscle because need the more power to push the blood inside the big vessel. And internal structure, internal wall covered by the endocardium, and endocardium made their valves, four valves of the heart: mitral valves and the tricuspid valves. So, what about the systole and diastole? What does it mean? The heart is in constant rhythmic activity, since, like I said the previous time, the contraction of the heart, it's called systola, contraction of the heart, and we have two systola of the atrium, because heart have four chambers, two atrium, two ventricles. So first of all, we have a constriction of the atrium, it will be systola atrium, and after this, systole of the ventricles, and the general pause or relaxation, it will be diastole, this one, diastole. And period, which included one contraction and one relaxation of the heart, it's called cardiac cycle. So in normal cardiac cycle, it's prolonged near the 0.8 seconds, things like this, because normal systole of the atrium, it's 0.1 seconds. Systole of ventricles, it's 0.3, and general pulse, it will be 0.4 seconds. Together, so 0.8. And heart constriction dependent on the age and on the person, right? So it means that in the newborn, it will be 140 beats in a minute. In an adult, it will be 75 beats in a minute. What does mean pulse? It's rhythmic acceleration of the blood vessels and occur due to the contraction and relaxation of the heart. And we have two factors of this: the intensity of the heart constrict and the resistance of the peripheral vessels. Since, like I said previous, the maximum contraction, it will be systolic pressure. Maximum contraction, it's contraction of the atrium and ventricles. Maximum relaxation fast, blood pressure decrease and become minimal. It can be diastolic pressure. And different between maximum and minimum pressure, systolic and diastolic, it's have the name the pulse pressure. In the human brachial artery, the maximum pressure, it will be near 110, 125 millimeters. Minimum diastolic pressure, 60, 80, actually 90 millimeters. And the pulse, it's near 40, 50. Okay, so in this picture, you can see in the middle, the heart, pumping blood, and two circles, small circle and big circle, blood circulation, right? Small, it's will be lungs. Big, it will be systematic. After this picture, I give it to you this information, more information. So it's an external structure of the heart. You can see the body of the heart, right? Two chambers, two atrium, and two ventricles. And main vessels, arteries, aorta, veins, vena cava superior, vena cava inferior. These arteries too, but included venous blood. It's pulmonary trunk. And this, it's veins, but included arterial blood. It's called right and left pulmonary veins. So what about internal structure? And actually all about the pumping blood, small and big circle. So the big circle starts in the left ventricle. The blood, as you can see, the left ventricle have more safe in front of the rest part of the heart wall, right? A lot of muscle help for pushing the blood inside the biggest arteries and whole body. It's called aorta. So the arterial blood, clean arterial blood from the left ventricle goes through the walls of aorta, which have three cuspids. Cuspids, look it like this one. It's a prevents regurgitation of the blood. Blood can return into the return back, prevented by this seminal events. So through the valves of aorta, the arterial blood from the left ventricles goes into the aorta, arch of aorta. From the arch of aorta, we have three branches. Remember, it will be arteria carotica communis, common carotid artery, arteria subclavian, right? And Stereotypical trunk. What do you mean? Brachiocephalic trunk. Okay. Sorry, guys. Okay. So after arch of aorta, we have the thoracic aorta, right? Thoracic. Thoracic aorta pass through the diaphragm and have the name the abdominal aorta. That supplies the abdominal cavity, organ of abdominal cavity. After this, in the region of the pelvic region, divided for the two arteries, arteria iliaca communis, dextra and sinistra, which divided for the external and internal iliac artery. External iliac artery, blood supply the lower limbs, the leg. Internal blood supply the organ of the pelvic region. So the arterious blood included the arterious arteries included arterious blood, oxygenated blood. This blood give it the oxygen into the muscle, into the organ, right? Take their deoxygenated blood, CO2 with CO2, right? And this deoxygenated blood accumulates in the base. And this blood from the lower limbs accumulates into the vena iliaca externa. Blood from the internal organ into the vena iliaca interna. Joins together, it's made the vena iliaca communis. Left and right communis, it will be vena cava inferior. And through the vena cava inferior, venous blood goes into the right atrium of the heart. It's a lower part of the body. Venous blood accumulates into vena cava inferior. From the upper part of the body, it's upper limbs. Upper limbs and their head and neck. So blood accumulates into the vena cava superior. So all of this together, this blood goes into the right atrium. From the right atrium, blood goes into the right ventricle through the tricuspid valves. Tricuspid valves have three cuspids. Three cuspids. Left, right, and subtilis. Okay, the blood from the right ventricles through the valves of pulmonary trunk, which have three cuspids too. Left, right, and front, goes into the pulmonary trunk. Pulmonary trunk. So, pulmonary trunk, truncus pulmonaris, it's arteries, but included the venous blood. It's a one place in whole body, but we have a difference. The arteries included venous blood, the veins included arterial blood. So pulmonary trunk, it's an artery, but included venous blood. This venous blood, through the pulmonary trunk, goes into the lungs, give it the deoxygenated blood, take the oxygen, and clean arterial blood through the pulmonary veins, left and right, goes into the left atrium. Left atrium. So actually, I see the first time I see and give it to you this information too. Now, this picture, it's have mistake about the color. You know? Maybe not. Left, palmar veins. Why not? No. Fine. Okay, then palmar veins. That's right, correct, because palmar veins, but you can see that palmar veins have red color, right? This one, but have the name veins. Why red color? Because included the clean arterial blood, but pulmonary trunk included venous blood, right? Okay, fine. The blood from the left atrium goes into the left ventricle through the mitral valves. It's a bicuspid valves. And from the left ventricles through the valves of aorta, which have 3 cuspids, left, right, and back one, goes into the aorta, arch of aorta too. So all the time, I see the picture, this one, the blood have this way from the pulmonary veins goes into the atrium, from left atrium into the left ventricles, from the left ventricles into the aorta, goes into the body, right? And accumulate into the vena cava superior, vena cava inferior, goes into the right atrium through tricuspid valve in the right ventricles, from the right ventricles through the valves of pulmonary trunk into the pulmonary trunk. So this one, pulmonary trunk, and into the lungs. Give it the oxygen, take the oxygen, and through one more time through the right and left pulmonary veins goes into the left atriums too. So it's moving of the blood inside heart. It's a back view of the heart, right? I have to know that it's a real heart. You can see the left and right atrium, left and right ventricles, pulmonary trunk, it's arch of aorta. This one, it's a vena cava superior. This one, it's a proper to the real heart. Internal structure, trabecular, right? It's right and left atrium. This picture demonstrates the strong muscle, cardiac muscle, biggest muscle located in the wall of the ventricles. So this one, it's valves of the heart, right? Tricuspid valves. You can see three cuspids from back and the septalis. Mitral valves, 2 cuspids, and valves of aortic, left, right, and back one, and pulmonary trunk, left, right, and front. So 4 valves of the heart. You can see 4 valves of the heart. So this one, it's a cardiac auscultation of the heart. So you can see that every valve have the point of auscultation, hearing, and it must be some order of this hearing. What does it mean? You can hearing, for example, that mitral mitral valve, you can hear the tricuspid valve before mitral, for example, or valves of aorta before mitral. So fast, it must be mitral valves. So fast mitral valves, you can see this mitral valve, look at it here, but projection in the front of the chest position here. This place, it will be, it's located, this place. Linea intermedio claviculare, left linea intermedio claviculare, crossing with fifth intercostal space, left fifth intercostal space, and 1.5 centimeters inside into the middle of the breastbone. So this point of hearing of mitral valve. It's a point of hearing apex beat. Next one, it will be point of hearing valves of aorta. It will be first and second, right? You can see first, second. Second, intercostal space into the right from the right margin of the breastbone here. After this, point number 3, it will be second intercostal space into the left of the left margin of the breastbone. Point of hearing pulmonary trunk. Number 4 here, it will be point of hearing of tricuspid valve. Point of hearing tricuspid valve. Well, it's over the xiphoid process of breastbone. Number 4. And actually, we have, it's not visible in this picture, but I give it to you. So in this place, inside intercostal space, into the left of the left margin of the breastbone, we have point of Botkin-Erba. Point of Botkin-Erba here. Of Botkin-Erba. It's supplementary points to hear and noise blood inside aorta. You can see aorta going here. So, one more time. First, you can hear the mitral valve. Second one, aortic valve. Third one, pulmonary trunk. Number 4, mitral valve here. And finally, supplementary point, Botkin-Erba, noise of aorta, blood noise. So, what about the margin, the border of the heart? I give it to you information about border of the heart. What about now this border? Because the border distinguishes the absolutely and relative border. Absolutely, it's border which is not covered by the lungs. This one, absolutely border. The relatives, it's normal size of the heart, like this one. So, distinguished upper absolutely and relative border, upper. So, upper relative border, it will be lower margin of the second rib into the left of the breastbone here. It's relative border, upper relative. Upper absolutely border, it's upper margin of the third rib. Upper absolute. Okay. The right border. A relative right border. It will be 1.5 centimeters into the right from the right margin of the breastbone, this one. It's relative right border. And absolutely right border, it will be left margin of the breastbone. And finally, the left border, Absolutely and relative, it's the same. It will be linea intermedio clavicularis, left, like this one. Linea intermedio clavicularis, crossing with the fifth intercostal space into the left from the breastbone. Left fifth intercostal space, crossing. It's left border. Why you must know where is located absolutely, where is relative border. So, since like I said, absolutely border not covered by the lungs, and when the heart stops, what do you have to do? You know this. The massage of the heart, right? Breathing, and the what? Inject the adrenaline inside heart. And if you know the absolutely body, you not damage the lungs. So relative body, it's like this one, and absolutely body, it's like just this part, this one. Oh. Okay, so it's a schematical picture, point of hearing, the valves of the heart. Mitral valves, aortic valves, pulmonary trunk, and tricuspid valves here. So it's a picture about the moving the blood and working of the semilunar valves. Protect regurgitation. So in this picture you can see valves open, so blood goes, venous blood goes from the right ventricles into the pulmonary trunk, or from the left ventricles into the aorta. Close, right? And blood can goes back. You can see. So semilunar valves closed. And this picture, it's atrioventricular valves closed. Closed. This one, it's mitral valves and tricuspid valves, right? Blood from the right atrium goes into the right ventricles. From the left atrium goes into the left ventricles. And in this place, so closed, tricuspid valves and mitral valves, and the blood can return back. It's a picture about conductive system, right? What does mean conductive system? So the heart have own innervate. What does mean? If, for example, I take my heart by my hands, right? In a few minutes, heart become constrict. So heart have own innervate inside. From this innervate responsible, there are two sinus, sinoatrial sinus and atrioventricular sinus, and sinoatrial nodes and atrioventricular nodes, and bundles. Bundles. It's a sinoatrial bundles, the atrioventricular bundles. So, sinoatrial nodes located into the region of the auricula of the right atrium. Atrioventricular nodes located in the septum between ventriculus, left and right ventricle. Here in the septum inside, located their atrioventricular nodes. Sinoatrial nodes made the impulse which constricts the atrium. Atrioventricular nodes made the impulse which is responsible for contraction of the ventricles. So sinus produce the impulse and Bendel's fasciculus transport this impulse. So sinoatrial nodes in this place produce the impulse and sinoatrial nodes transport this impulse to the atrioventricular nodes, and atrioventricular nodes from atrioventricular nodes start the fasciculus of his atrioventricular fasciculus, which located and finish blind inside the wall of the ventriculus. One more time, auricular responsible for the constriction of the atrium, it's systole of the atrium, and for systole of the ventricles responsible for this atrioventricular nodes, which located in the wall in the located between left and right ventricles. Left and right ventricles. In this picture, you can see the set circle. Since, like I said, we have two circles, big and small, palmar and central circle, right? And this one, it's a set circle. Set circle. Heart, it's an organ which needs the oxygen too, seems like another one, right? So the blood into the heart goes through there, arterial blood goes through there. Arteria coronaria dextra and sinistra, and venous outflow from the heart, moving by the vena cordis magna and vena cordis parva and vena cordis media, this one. Homolate this blood into the coronary sinus coronaris, which open with the vena cava superior and vena cava superior into the right atrium, It blood supply wall of the heart. So it's developed of the heart, right? Developed of the heart start from the 14 days of the fat, right? And till to the end of the first month, finish. You can see the stages which develop the heart. In the start of the second month, fat have normal heart, things like this one. No, not normal heart, but developed enough like this one. So it's, if you know, that's heart of the fat working in the half part. What does it mean? It means that fat have just one circle, systematic circle, big circle. Fat have no pulmonary circle because lungs not function in fat, right, inside the woman body. So that's why we have this structure. It's ductus arteriosus, batal ducts, which closed after birth. And we have oval window, foramen ovale. It's open between right and left atrium. That's why in the fat, the blood mixed. In the other body, the blood not mixed, right? In the right part of the heart, we have just veins blood. Into the left part of the heart, we have just arteries. Fat, it's mixed. One more time, because what? Because why? Because fat have no another circle have no the pulmonary circle. That's why mixed blood. And after birth, after second or third month after birth, this oval window in norm must be closed, actually. But I know that 25% of human in whole world have now closed this open. And a lot of doctors, scientists, said that it's not a pathology, actually. And if sometimes, no, actually not sometimes, in many variants, if the patient have this pathologies, right, open foramen window, foramen oval, have normal life till to the 80 years more. Okay, so, okay guys, I thank you for your attention, and I hope that's my lecture, you like my lecture, and give it to you my appreciate, and good luck and good health. Bye.